Welcome to our panel discussion, She Leads in Crisis. My name is Peter Walton and I'm the Chief Executive Officer of CARE Australia. Good morning, good afternoon or good evening, wherever you are dialing in from. I am dialing in from Melbourne in Australia. So let me start by acknowledging the traditional owners of the land I am on, the Wurundjeri people of the Kulin Nation, and pay my respect to elders past, present and emerging. Today's panel convenes local voices, local Pacific voices, and they're here to discuss their experiences about gender in emergencies and promoting the role of women responding to disasters, especially climate-related disasters. CARE's experience in humanitarian activities has demonstrated the essential role of women's leadership in disaster risk reduction for reducing the disproportionate impact on women, the disproportionate death and injury caused to women and children in emergencies and the aftermath of them. This panel, we will hear three case studies from three different Pacific nations, three panelists talking about their own experiences in disasters, what they have done in their own communities, and what their visions are for their people, especially women and girls. I'm sure you'll all find it really engaging and in line with the conference themes, provocative in terms of unpacking how the broader humanitarian system needs to change to get a better bargain for women and girls and both support and value locally led. So let me start by setting the scene a little bit more. Earlier this year, CARE released a report entitled Time for a Better Bargain, How the Aid System Shortchanges Women and Girls in Crisis. It's a report that is really a call to action for change. Gender equality, as many of you will know, is a key driver of poverty and one of the most widespread forms of injustice in the world. Gender equality will never be achieved while women have fewer economic rights, less control over economic resources, and less access to economic opportunities than men. It is fundamentally an issue of social and of economic justice. Yet in a humanitarian context, the injustice is even more stark. Women and children are 14 times more likely or more at risk of death and injury in an emergency and in its aftermath. And there are some obvious reasons for this stark imbalance. Sometimes it's social roles where women and children are likely to be in the domestic sphere, in poorly constructed homes, while men are often in open spaces such as farms, gardens, or at sea. Women often take the primary care of responsibility for children and the elderly. So this may slow down opportunities to protect themselves or to escape a disaster. In some cases, it could be as simple as girls not being taught to swim where often boys are, and so therefore at greater risk during tsunamis and floods. But I have to say, when I first got this report and I read the stark imbalance, I was alarmed, especially because it is the choices that we collectively make in the humanitarian system that actually tolerates this imbalance. It is a question of resourcing, of course, but it's also fundamentally a question of power. Even in Pacific communities where women hold traditional titles and where matrilineal ownership of resources such as land actually exists, community decisions and decision-making often tends to be dominated by male traditional leaders. Women are often found in small numbers on community decision-making bodies and in consultations, small numbers in terms of consultations on disaster risk management and climate change adaptation. This underrepresentation makes them less likely to receive critical information for preparedness and also less likely to be able to influence decisions that ensure that the very root causes that put other women or children at risk are actually addressed. CARE's experience in humanitarian activities has demonstrated the essential role of women's leadership in disaster risk reduction for reducing the disproportionate death and injury caused to women and children in emergencies and their aftermath. This makes sense. I think you would all agree it makes sense. So why isn't the humanitarian system doing more? Well, despite promises, despite pledges, despite commitments, our report, Time for a Better Bargain, has shown that for most OECD donors, they have failed to significantly increase funding to women's groups in fragile and conflict-affected states. Most have not sufficiently funded gender equality programs, and sadly, COVID, as we all know, threatens to reverse even modest gains. So our report argues that support for local civil society, and you'll hear from many female leaders of civil society today, especially women-led organisations, needs to be made a much more explicit and much more accountable strategic priority for donors. For example, here in Australia, where I'm based, only 0.3% of Australian aid goes to fragile states, goes directly to local women's groups. Humanitarian programs, locally led humanitarian action, cannot be successful if the starting point is excluding those most at risk. So including women and men in decision making adds value to informing services that are more responsive, draws from knowledge, especially local knowledge, draws on the perspectives of local and ideas from diverse communities, but ultimately it helps realize rights more effectively for a much broader set of people. So this session is an opportunity to hear directly from women leaders working in the Pacific, making a real difference despite the barriers and the lack of stable support that we are seeing from many international donors. Our speakers tonight come from 3 of the top 5 highest ranked countries at risk of climate-related disaster. So without further ado, let me introduce our very first speaker tonight. Elma Panisi is country manager for Live and Learn in the Solomon Islands, a non-government organisation with a vision to create a sustainable and equitable world free from poverty. Elma has worked with Live and Learn for over a decade and obtained an MBA at the University of the South Pacific in Fiji. She has experience in a range of project delivery, including in water and sanitation and hygiene, natural resource management, conservation and agricultural projects, as well as disaster-ready programs. So welcome, Elma, and we look forward to hearing from you this evening or this morning, wherever you may be.
Hello, and good evening, good morning, or good afternoon from wherever you are. I am happy to join this discussion today. I have worked at Live and Learn for more than 12 years now. The last 7 years as country manager for Live and Learn. And Live and Learn works across the Pacific on projects including WASH in communities, conservation and natural resources management, gender-based violence response and peace building, as well as disaster ready, to name a few. In 2014, flash flooding killed 19 people and left 50,000 homeless in Honiara, the capital of Solomon Islands. In the aftermath and recovery, a lot of families were relocated, but the land they were relocated to is still at the risk of flooding. The communities that were affected by the floods that had been relocated to new sites are still in danger of being swept away by low-lying streams and landslides from the hills, as the people carved and cut the hills to make more space. Also, there is no road accessibility and the houses were not permanent. So Live and Learn works with the Honiara City Council to engage communities who have been relocated on the outskirts of Honiara and at the risk of future disasters. We are currently working with 12 or 13 communities and 11 schools to strengthen local humanitarian capacity. For example, through the Disaster Ready Project, disaster risk reduction activities in the AHP program includes the following activities: awareness in schools and communities, disaster management plans for schools and communities, disaster drills for schools and communities, and also we provide signage and maps for disaster evacuation to safe areas. The School Disaster Preparedness Drill and establishment of Village Disaster Climate Risk Committee has been in partnership, consultations and coordination with the National Disaster Management Office, or NDMO, and the Honiara City Council and the Meteorological Service. Over 2019, we worked with 5 schools and had earthquake and tsunami drills and established 4 community committees. While we hadn't originally planned to do this, it was a strong request from the council and community. With the communities we are working with, this is the first time they have received targeted disaster awareness and set up committees. For some of the schools, this was a chance to revisit training they hadn't had since 2013. We are proud that we are able to work with communities that need the support the most. Sometimes in Solomon Islands, the sharing of resources and supports after a disaster is impacted by political decisions. We recently visited a community, but found them all gone. The rains had destroyed their homes and they were sheltering in a church. The church leader told us that they were unable to access support because there was a concern that they hadn't voted the right way. These community dynamics can often impact on resource distribution, and we know this is not a problem unique to our country. As a local humanitarian agency, we were able to get the support needed to the people who needed it. Most recently, our COVID-19 response also has included washing schools and communities. We distribute soaps and jerry cans for schools and communities. We supply tanks for schools, and we did health awareness to schools. And under food security and livelihood, we provided basic training on agriculture to support communities on how to manage livelihood during the lockdown and pandemic. We also provided tools to communities for backyard gardening, and we support the YWCA Women in Agriculture training and also provide tools to them. As part of the COVID-19 response, we have been raising awareness on menstrual hygiene management by distributing products to schools and with the YWCA. For Live and Learn, it is important to build coalitions and work in collaboration, as we know that that works for resilient communities. This also extends to our work with women who are often forgotten in disaster response and planning. Often women are not engaged in the management and planning for disasters, so their needs are forgotten. We have been working to improve our understanding of gender impacts of disasters and work with CARE to ensure appropriate and accessible response for women and girls. Thank you for listening.
Thank you very much, Elma. Look, I know people who are tuning in to this, please, we will have time for lots of questions at the end, but we're going to go through all of the presentations. But firstly, thank you ever so much, Elma. Elma's feeling a little bit under the weather today, so we really do appreciate you still taking the time to join in. And of course, in the Solomon Islands, it's quite late, so thank you. But we're going to move straight to our next panelist. And it's my great privilege to introduce Vanessa Heleta, who is the founder and the director of the Talitha project, which runs a drop-in centre for young women and girls in Tonga, providing security, training, income generation skills and support. Vanessa has worked to raise the marriage age in Tonga through the Let Girls Be Girls campaign. She also contributed to the formation of the Special Olympics in Tonga, supporting athletes to win Tonga's first gold medal in any international games at the 2015 games, which just sounds like such an incredible and exciting time, Vanessa. But over to you to tell us all about your project. Thank you.
Thank you, Peter, and good evening to all my fellow speakers from the Solomons and Vanuatu. And hello, Charlie. First foremost, I would like to thank you for having me. I don't know what I can contribute because our little NGOs is very small compared to Live and Learn and Care Vanuatu, Care Australia, but I will try my best. I think it's important to set the scene. How I got involved with Talitha project, how I found Talitha, because I think it's important to know the background of where I came from. I grew up in a broken family, and I had a very hard time with my stepfather abusing me. So as a young girl and a young woman, I grew up with a lot of bitterness and did a lot of things that was not supposed to be doing. And I went to USP in Fiji, and I had all these anger issues with me, and I managed, thank God, I don't know, for some reason, it was a miracle to get my degree and also a BA and also BY. So I got a degree and a baby at the same time. So I came back to Tonga hoping to go to a civil servant job. I applied to a few jobs, and I saw this ad, and it was an advertisement for admin officer in the Tonga National Center for Women and Children. So I applied. The pay was only $20 a day, but I really needed the job because I was a single mother. I had to feed my baby. So I took the job anyway. And while I was working, I think within 4 or 5 months, they asked me, Vanessa, would you like to go to Fiji? And I said, whatever for? And they said, oh, you'll be attending this wonderful workshop. And they gave me the program. And then I saw all these gender, these words, human rights, gender and human rights, and what have you, all the terms that we're using right now, gender equality. I never heard of those words before. So I said, oh gosh, what am I going to do in Fiji with, what am I doing with in this workshop? So I just said yes, and I went along to, it was a Fiji Women's Rights Crisis Center, 2 weeks intensive training. So I came back, and I have never been the same. So that training changed my perspective, changed who I am completely. And I work for NGOs, Tonga Family Health, and a few others. And then it led me to set up Talitha Project, because I look at my context here in Tonga, and then I thought, what can I do to give back to my country, which is not provided for? So I saw that there was a lot of gap in providing services for young women and young girls in Tonga. So it led me to set up Talitha Project. So really Talitha is all about empowering young women, young girls aged 10 to 25. So we do a lot of programs with adolescent girls in Tonga, giving them life skills and helping them to be the CEO of themselves, to be the CEO of decision making, and also at the same time, what they can do to help contribute to the community, and and also become good citizenship. So we have been running for I believe 11 years now. So is that what you want me to do, Peter? Just the introduction, right? Yeah. So thank you. So that was how I came to form Talitha Project. Thank you.
That's great. Thank you very much, Vanessa. And just for those in the audience, the panel can't see who's actually online, so please do start jotting down your questions to be fed through, so we can start compiling them for the end. But thank you very much, Vanessa. Now we're going to go on to our third speaker for the evening, Julia Marengo. Julia is Resilience Manager with CARE in Vanuatu, and has been with CARE for more than 8 years, originally joining the organisation as an intern. She has responded to many disasters and was acting response manager during Tropical Cyclone Harold, a Category 5 cyclone, as we all know, that hit the country right in the midst of COVID globally. Julia was also one of the first 2 CARE Vanuatu staff members to be internationally deployed for an emergency response, working as part of Live and Learn Care Partnership in Fiji following Tropical Cyclone Winston, another superstorm Category 5 that hit the region. So welcome, Julia, over to you.
Thank you. Good night or good morning to everyone who are tuning in. Thank you very much for the opportunity to be part of this presentation. As our studies saw, in early April 2020, after the world had locked down for COVID-19, Cyclone Arrow tore across Fiji, Solomon Islands, Vanuatu, and Tonga, and tens of thousands of people were injured and made homeless across the three nations. I was acting response manager for Care Vanuatu for the DC Harold response. In Vanuatu, more than half of the country's populations were impacted by the widespread destruction to houses, garden crops, and infrastructures. The Category 5 storm knocked out communications, wiped out homes, and flattened the entire villages across a number of islands. Thousands of families found themselves in urgent need of shelter, water, food, and basic supplies. With Vanuatu geographical location and the challenges of getting out there, we sprang into action and had teams on the ground in two of the islands, Hambrem and Pentecost. It was a challenging task in the aftermath with limited communication, making it a lot more challenging. But that does not stop us from responding to the needs. We coordinated distribution plans with team leaders on ground and provided logistical support to the response team to ensure that relief supplies went to those who needed them most. It was challenging mobilizing people for the immediate response in these communities where we had a very strong culture of male being leaders. On top of that, being a female leader from outside the community was even more challenging. But our first engagement with the community is by going through the gatekeepers. The gatekeepers of the communities were the community leaders and the chiefs, to ensure that they understand our project, the work that we want to do, how we do it, and also including the importance of engaging women and girls in all our activities. Once we have their support, it is much easier to do this work at the community level. The discussions we had with the chiefs includes why it is important that the team can speak with everyone in the community, women, girls, men, boys, and people with disabilities, and even others. These consultations with the chief is as important as doing the distribution work and the shelter work. And it means that communities better understand what is happening, and it means how response work can benefit everyone, including women and girls who otherwise might have missed out. In places like Pentecost, we prioritize this work with our partners. So we had a very strong collaborations with our partners on ground that to make sure that we leave no one behind, and there is accountability and transparency, and there is fairness in the distribution, and relief supplies reach everyone. So the partners that we worked with on the ground are the Vanuatu Red Cross and the churches. So with our partners, we explain, for example, that during distribution, women should be present along with men or their husbands, even women with women who have female-headed households. Similarly, we also discussed that some activities or some relief items are just for women's group or women only, such as the dignity kits. But we explain this to everyone so there is understanding and support for it. These discussions are not only important to ensure that everyone in the community can fit into our response work and understand what we're doing, but it also paves the way for us to have more in-depth discussions or activities around gender driven by the community themselves. For example, a couple of months ago, we received a letter that was jointly signed by all the chiefs of South Pentecost asking for training on gender, training for them and for their communities, which really stood out for us, because talking about gender in Pentecost was a very sensitive issue, and it is directly against our cultural norms and practices. We introduced the topic of gender, but used very simple language that they could understand and engage with. Sometimes we don't even tell them we're talking about gender, but they are learning about it even without knowing it. These approaches helps us a lot in making ways for recovery inclusion activities so everyone benefits from it, which we did at the recovery phase. The benefits of preparedness in the disaster response were also tracked and reported after Tropical Cyclone Pam, which hit Vanuatu in 2015. Investing in disaster risk management and involving women across all stages of preparedness and response is vital. A key finding of the research in 2015 is that receiving early warning is not enough, and people need knowledge of appropriate actions and ongoing support to keep this knowledge up to date. So CARE's work on women's leadership in community-based disaster committees found that where gender equality training had been delivered and women led taking up leadership roles, the community has a whole work together more effectively. We were able to apply these lessons also in the response to Cyclone Harold. Having had prior training in disaster risk management and disaster preparedness, the community disaster and climate change committees in Pentecost and their respective communities were proactive and organized to support a fair distribution of all the relief items to the most affected communities and households. Being a woman leading the response in emergencies really gives me the confidence to help other women who have been affected by Tropical Cyclone Harold and only have limited access to services or lack opportunities for decision making. It was good to see women gathered at the distribution sites in both Highland, Ambrem, and Pentecost getting the information they needed. It was often challenging to involve these women as they were concentrating on looking after their children or listening from a distance. I made sure to speak with them directly, these women and girls. To sum up, leading a response and being part of several responses, I felt the need to empower women who are affected by disaster. But it cannot happen if you do not have the passion to do it. It needs your heart to go right down to their level, sit down with them, speak, and listen to them so they know and understand that they're being heard and supported and are involved in decision making. Thank you, Thomas.
Thank you ever so much, Julia, for that. And for anyone who's ever heard me talk, especially around some of the huge cyclones that have hit the Pacific region, I think that's a fine way to finish, because a Pacific Islander once said to me in the context of what would a locally led humanitarian system look like in the Pacific, he said, well, what we need at times of disaster is a locally made canoe, but frequently you send in a battleship. And it really resonated with me around, making sure that we genuinely are locally led, that we understand the people that know what's best for communities are the communities. So there are some fundamental shifts that are needed. And I have reflected frequently on Tropical Cyclone Pam in 2015 that Julia just spoke about, where well over 100 international organizations landed on Vanuatu and effectively bypassed much of what had been put in place in terms of local community resilience. But last year, in contrast, an international surge system was not operating because of COVID. And Cyclone Harold really sort of had a response, which I think there's some critical lessons in terms of how we all need to change.